Hello, my name is Orlando Hinojosa, and this presentation is titled Correlation Between Spontaneous Swallowing Frequency and Reported Swallowing Dysfunction in Adults with Parkinson's Disease. I'm a practicing speech-language pathologist and a PhD student at UT Health Science Center in San Antonio, and this project was completed in collaboration with Dr. Giselle Carnaby. Parkinson's disease is a neurological disease caused by degeneration of nerve cells in the part of the brain called the substantia nigra, which controls movement. These nerve cells die or become impaired, losing their ability to produce dopamine. Dopamine is a neurotransmitter that works in the brain and helps nerve cells. Dopamine also plays a critical part in motor control, cognition, and our body's reward system. Parkinson's disease stands as the fastest growing neurological disease globally, with projections indicating over 9 million individuals affected by 2030. It's important to know that over 80% of individuals with Parkinson's encounter trouble swallowing or dysphagia at some point during their illness. This complication often leads to aspiration pneumonia, which is cited as the primary cause of death in Parkinson's, accounting for up to 70% of mortality rates. Despite medical interventions showing limited efficacy in addressing swallowing difficulties in Parkinson's, behavioral treatments or therapy have emerged as a standard of care for managing Parkinson's-related dysphagia. While dysphagia in Parkinson's is significant and can have devastating impacts, few patients complain of swallowing issues. As a result, while dysphagia is present early in the disease, it is often underrecognized, while with evaluation and intervention typically delayed until after a patient displays obvious issues. In this study, we sought to identify if a new non-invasive and objective metric of swallowing functions, spontaneous swallowing frequency, could reflect Parkinson's severity and dysphagia in a group of Parkinson's patients. So what is spontaneous swallowing frequency? Spontaneous swallowing is the act of unconsciously swallowing saliva. It involves the reflexive pharyngeal swallow to clear the larynx and pharynx of unwanted material. Although it is primarily a brainstem reflex, it has extensive cortical and subcortical input and modulation. Further, it is the acoustic measurement of spontaneous, unstimulated swallowing rate over a 10 to 15 minute period. Spontaneous swallowing is measured with an acoustic recording obtained with a miniature microphone connected to a digital voice recorder. The microphone is adhered to the skin of the lateral neck in the region called the Takahashi spot. The recording is then processed using specialized acoustic software. This software plays a critical role in the measurement process as it analyzes the recording and generates a visual trace of the data, which is displayed alongside the auditory signal. This metric has been validated in stroke and head and neck cancer populations to reflect the presence of swallowing issues in these groups. This study aims to determine whether spontaneous swallowing frequency is related to dysphagia metrics and severity in patients with Parkinson's disease, as there is currently no data on this metric in this group. So now on to the method section. This study included 12 subjects with Parkinson's disease. They were all outpatients referred by neurology, speech-language pathologists, or self-referrals. Spontaneous swallowing frequency was acoustically recorded for 10 minutes in all subjects, with an acoustic sensor placed on the lateral neck. Subjects were seated in a quiet and relaxed setting while watching a silent oceanic video for the same duration. There you can see a photograph of one of our participants and the miniature microphone placed to the lateral neck in the spot called the Takahashi spot. The recorded signals were analyzed to measure the maximal peaks of swallowing sounds. The distinct sounds can be characterized as saliva moving through the pharynx, creating a slight sloshing sound, further amplifying sound transmission during the swallow. The characteristics can be determined as moist, muffled quality, contributing to the overall wetness of the swallow. And I'm going to play the acoustic analysis of the spontaneous swallow. There you can hear some breathing sounds from one of our participants. And there you heard the swallow, and again characterized as moist with a muffled quality, and again contributing to the overall wetness of the swallow. On the table below, we are able to see the variables and the information collected from the 12 participants. 7 out of 12 are married, 10 out of 12 are non-Hispanic white participants. The mean education level being 14 years. The Hinojosa average score is 3.27. The Hinojosa is a commonly used system for describing how the symptoms of Parkinson's progress. The mean duration of disease being 6 years. The presence of deep brain stimulation, so 7 out of 12 participants mentioned having a deep brain stimulation device. The MASA, man swallowing score, which identifies swallowing severity, 172.7. The functional oral intake scale is at 5. Average perception of swallowing difficulty, 7.5 out of 10. Reported drooling, 8 of the 12 participants reported drooling, and the mean EAT-10 score is 8.25. The EAT-10 is a self-administered symptom-specific outcome instrument for dysphagia, and anything above a 3 is swallowing difficulty. So now we can move on to the results section. Cross-sectional data was analyzed using non-parametric Spearman's Rho and Mann-Whitney U and displayed graphically. Results of this study demonstrate a correlation of spontaneous swallowing frequency with the duration of Parkinson's disease in months, the clinical swallowing disability score using the MASA, Parkinson's disease severity using the Hone-Yar scale, and how lower spontaneous swallowing frequency is related to the presence of deep brain stimulation. Below you can see the graphs. The first graph shows a correlation of spontaneous swallowing frequency to Parkinson's severity, again using the Hone-Yar scale. In figure 2, we can see the correlation of spontaneous swallowing frequency with the MASA score. In figure 3, we see the correlation of spontaneous swallowing frequency to duration of Parkinson's in months. And figure 4 shows that lower spontaneous swallows is related to the presence of deep brain stimulation. As part of the results, spontaneous swallowing was not related to age, gender, body mass index, education level, diet level, EAT-10, tongue strength, self-perception of swallowing difficulty, or level of swallowing fear. To conclude this presentation, spontaneous swallowing frequency demonstrates the potential to be a portable, non-invasive, language-independent objective measure to monitor swallowing function in patients with Parkinson's disease. It is a straightforward measure that offers advantages, again, such as being language and cognitive independent. This makes spontaneous swallowing frequency a promising tool for monitoring patient progress over time, allowing for direct care and tracking disease status changes. Despite its potential, spontaneous swallowing frequency should not be seen as a replacement for more detailed instrumentation methods, such as a FEES and a video fluoroscopic swallow study. Current understanding of spontaneous swallowing frequency is still limited, and it is important to note that swallowing frequency can fluctuate after eating. Moreover, spontaneous swallowing tends to be faster in younger adults and those who are obese, indicating that individual characteristics may influence its effectiveness as a monitoring tool. This is the end of my presentation, and the references are provided.